Hello and welcome everyone. I'm Dr. Nick Stefanoff and I'm moderating today's Plant Powered Challenge. I'm so glad you're joining us as we continue to explore how we can nourish our bodies and our minds with our healthy plant foods. Today's session is the impact of nutrition and lifestyle on men's health. And I am delighted to have Dr. Kevin Billups here to teach us about it. Dr. Billups is a highly experienced urologist and men's health specialist who has dedicated more than 30 years to the field. He focuses on men's health and sexual medicine, and he's an authority on erectile dysfunction, testosterone deficiency, and chronic medical conditions like diabetes, hypertension, obesity, heart disease. His approach combines traditional medicine with lifestyle changes like improving nutrition and exercise, sleep, and mindset. He has a special interest on how lifestyle affects prostate cancer and enlarged prostate. Dr. Kevin Billups graduated from Harvard University. He went to medical school at Johns Hopkins. He did urology residency at Johns Hopkins and a fellowship in urology, sexual medicine, and vascular physiology at University of Virginia. He's a certified diplomat of the American Board of Lifestyle Medicine. And lately, he's the president of practice operations, the chief medical officer for Mihari Health Solutions. He's the director of restorative health and lifestyle medicine for the Mihari Health Network. And he's a professor of internal medicine and urology at Mihari Medical College in Nashville, Tennessee. So I'm eager to hear from you, Dr. Billups.
All right. So thank you, Nick, and looking forward to this presentation. Let me just bring my slides up.
Great.
And we'll get going here. All right. So what I want to talk to you today about is I'm going to talk about the impact of nutrition and life changes on men's health. So you see, let me just get started here. Get this. Here we go. All right, so I'm going to give I'll give a little bit of overview of the problem. I kind of like to kind of start out and then kind of zero in. I'm going to talk a lot about the impact of lifestyle medicine, because one of the things in men's health that I've gotten really passionate about is actually using lifestyle changes to impact men's health. And then we'll talk a little bit about the future moving forward. Nothing for me to disclose. And so I'm going to focus on prevention. This was a quote from Thomas Edison back in 1903, and it just talks about if you look in the doctor of the future is really going to focus more on a diet and the prevention of disease. So I like to kind of start that out as the theme. But the first thing I like to pose and talk about is, what is men's health exactly? Because men's health can mean a lot of different things to a lot of people. So I know we don't have a poll here, but I just put up, just for your consideration, when you think about men's health, what does that mean to you? What comes to mind first? A lot of people, it'll be prostate health. You talk about prostate cancer or benign enlargement of the prostate or inflammation of the prostate, that's prostatitis. You can focus on metabolic health, and that to me is high blood pressure. It can be diabetes, it can be cardiovascular diseases, certainly mental and emotional health. Sexual health, my training and background is in sexual health, sexual medicine, erectile dysfunction, low testosterone, fertility issues, but I link them to chronic disease. So really my practice is much more of a chronic prevention practice for men. You have social connections and loneliness. These are this is another important aspect of men's health. And then you can get into physical fitness and nutrition, nutritional health. So these are different things people will consider. I would argue that men's health really encompasses almost all of these. And so I'm going to give you talk today kind of really my approach to men's health, my philosophy. So Nick nicely kind of went through the academic part of me, and I had that up here, but that's not why I put this slide up. I want just to spend a few minutes to let you know about how I got into lifestyle medicine and kind of a little bit about my journey, because it'll impact some. It'll make more sense about what I'm going to talk to you about. So I actually started on my healthy lifestyle journey. It was about actually closer to 10 years ago now. I remember because it was when I started at Meharry. And what had happened was when I started, I had reached a point in my career, I was really busy. Practice was booming, but I had completely let myself go. I mean, I was a good 40, 50 pounds overweight. Blood pressure was going up. Blood sugar was heading the wrong, cholesterol was in the wrong direction. Everything was heading the wrong direction. But being a man, I said, I have this under control. I'll just flip a switch whenever I'm ready and I'll get rid of this and I'm not going to worry about this. And was just kind of going down the tubes. Fortunately for me, a good friend of mine pulled me aside and he said, I'm giving a program on lifestyle and behavioral changes. It was in Chicago. And he said, I want you to come to this program. I really want you to come to this. And I said no at first. I was like, I'm too busy. I don't have time for this. Some reason I went ahead and I went. And when I listened to what was being presented to me, a lot of what I'm going to talk to you about, two things struck me. One was that this was really evidence-based. So I was like, I'm ignoring this at my own risk at this point. And so I listened and I said, all right, I'm going to go back and just jump in, full bore and go do this. And I did it when I went back. But I'll tell you, honestly, what I was thinking was, I can fail this quickly and I can get back to my old ways and not be bothered with this anymore. But I took it seriously and started doing it and made these changes. And what I noticed was, over about 3 or 4 months, I dropped about 40 pounds. My energy level went up to where it hadn't been. All those problems and challenges I was having reversed. So it made a huge personal impact on me. And I started putting this into my practice. And I started noting the same changes in my patients. I had men who were getting off of diabetic medicines, getting off of high blood pressure medicines. They were coming into me for erectile dysfunction and low testosterone. All of that was getting better on these lifestyle changes because it's all what we call metabolic disease that we'll go over in a minute. So I started seeing those practices, and then as I do teach medical students. And I started telling my medical students, you all really have to learn this. So the things I'm going to talk to you about, have a personal impact for me, and I'm really passionate about getting this message out. So looking forward to this. So what's the truth about our health, right? Those of us that are listening to this, most of us are living with these 4 conditions. So if you look at high blood pressure or hypertension, 50% of US adults have hypertension. That means 50% of us watching this webinar are going to have hypertension, whether we know it or we don't. And if you're being treated for high blood pressure, you still have high blood pressure. You just have treated hypertension, even if your levels are normal. 50% diabetes or pre-diabetes. 40% of US adults will have high cholesterol, and that depends on how you want to define high cholesterol. And then 75% of US adults are either overweight or obese. So that's the truth about what we're living with right now. Now, if you look at what's going on in America in terms of chronic disease, the bottom line is that we're living in, our system is built for sick care. We wait for you to get sick and then we spring into action. This slide, it just goes over the top 10 causes of death: heart disease, cancer, different things that we're all aware about. The big 4 that I'm going to spend more time on are high blood pressure, diabetes, obesity, heart disease. And I'm going to spend time on that because they impact all health, especially men's health, and even the kind of sexual health, testosterone and erectile dysfunction issues that I deal with quite a bit. African Americans are disproportionately affected by these problems. And the current system has a focus on treatment, medication treatment, as opposed to some of the lifestyle things that I want to bring in. So diabetes, we all know this is a huge problem, right? Diabetes and pre-diabetes. So I just put some numbers up here just to give you a thought. Over 29 million Americans have diagnosed diabetes, and another almost 10 million undiagnosed. Look at the number of pre-diabetes. You have to get a blood test and go in to find out if you have pre-diabetes. So look at those numbers there. Look at the treatment costs. This is, and I'm sure this is over 350 billion annually now. And 42% of Americans have 2 or more chronic medical conditions. So this is a major problem that you all know that we're talking about. So, really, I've talked about the cost, but what I really want to focus on is that we really need to move to a system and a culture that's grounded in prevention and restorative health. So people ask me, what do you mean when I say restorative health? Well, here's the bottom line. When I see people in the clinic nowadays, it isn't about prevention. I mean, the prevention window has passed when I see most of my patients in the clinic. People are sick. They have the diabetes, the high blood pressure, the things that we're talking about. The first thing I have to do is restore you to some semblance of normal health, maintain that, and then prevent you from getting sick again. So I like the term restorative health or restorative medicine. Now, the big challenge in terms of lifestyle is, how do you actually get people interested in the concept of lifestyle and taking care of themselves? And so that's that's some of what we'll go on. Now, the way I approach men's health, I found that what patients and what men are interested in is the symptoms, right? I mean, all those conditions I mentioned, yeah, you may know you have them, but people initially come in with symptoms. So what do men care about? And these are what I found to be the most engaging symptoms for men. The reason that they come in to see me and give me that opportunity to take care of them. Weight gain is important. Urinary symptoms, and that can come from prostate enlargement that can slow your urinary stream. It can do a number of different things there. Low energy and low fatigue, that can be related to low testosterone. And then there's erectile dysfunction as well as low testosterone. And interestingly, the symptom of erectile dysfunction, and most people don't think is erectile dysfunction, is when you have difficulty actually keeping a firm erection. So you lose the erection too quickly. A lot of people think erectile dysfunction is when you just don't get anything anymore. And honestly, that's end stage ED. The earliest symptom that is years ahead of other problems is I can't keep an erection. You'll lose it too quickly. I call it the flat tire syndrome. But that's important because it can be a marker for other things going on. Cognitive decline. A lot of people come in talking about brain fog, having some memory issues, headache, insomnia. This country has a lot of problems with insomnia. Depression, stress, anxiety, snoring can be a sign of sleep apnea, and a lot of pain issues, back pain, neck pain, knee pain, a lot of it, related to arthritis, gout, acid reflux, and then of course sciatica. These are the reasons that men actually come in, and then we link these things. So here's a bottom line. I call these the 4 keys to optimal health. And why do I call them that? Because if you understand these four things these four pillars of metabolic health that I'm going to talk about, if you understand these, you understand really how you can take control of your health. And so I really emphasize to the men I see, you need to know these numbers, and you need to understand what they mean. So you look at blood pressure. I put the optimal there. It should be less than 120/80. You look at your blood sugar. I just put one parameter. That's your fasting blood sugar. Should be less than 100. We also look at the hemoglobin A1C. That's a long-term marker. I put some cholesterol values there. Everybody focuses on the bad cholesterol or the LDL cholesterol, which should be less than 100. But the reality of it is, you have to look at your good cholesterol, the HDL. You have to look at your triglyceride levels. There's some fancier tests that I can get that can look at different types of cholesterol risk. Now, here's the big one I'm going to spend some time on: waist size. Now, the waist size. Now, less than 40 inches in men. Everyone, when you say waist size, they want to tell me their pant size. I don't care about your pant size, because it's not the pant size. You have to measure yourself at the level of the belly button. Take out a tape measure and measure yourself. And that is where the real risk comes in. Now, an easy way to remember this: if you take that tape measure out and measure yourself, that number should be less than 1/2 of your height in inches. That's a good way. We use less than 40, but the reality of it is, even if you're a little less than 40, that's actually not that great. So less than half your height in inches is a good way to look at that. And why is that important? Well, let's get into what really is going on here, right? Again, getting at the root cause of all these problems. I call it the food trap. It keeps us coming back. Now, to some of us, that may look good in the past, but whatever. It's really fast, cheap food that we have access to, right? I won't name any of the brands. I'm not going to do that. You all know what they are. These foods are engineered for addiction: fats, salts, sweets. we become addicted. The same centers in the brain, if we do an MRI, that light up for opioid addiction, other addictions, light up when you look at some of these foods. So here we are, the standard American diet, and the abbreviations are appropriately SAD for SAD, because what is it? What is our typical diet linked to? The diabetes type 2 I talked about, high blood pressure, obesity, cholesterol, all those things that I just mentioned. You can link it also to mental and emotional health issues. You can link it to, I'm going to talk in a second about visceral fat, or belly fat is an easier way to think about it, and inflammation. But these are the effects of fast food. Now, I'm sure this slide doesn't look familiar to anybody who's looking at this, but for those few of us that do, does this ring a bell for anybody? You know, now I hate to admit it, but when I was growing up, and even earlier, even years ago, when my kids were younger, you know, Friday night was pizza night. And we couldn't just get one pizza and share it. Everybody had to get their own large pizza. And so if you look at this, what is wrong with this picture of, this is a typical week's worth of groceries for an American family. And what do we see? We see a lot of processed foods there, right? We don't see a lot of whole foods, you know, that we're going to talk about, greens, things like that. We just don't see that. And that's at the root of a lot of what's going on, because these are highly processed foods. So I mentioned fat, salt, sweets. They're addictive, just like cocaine and opioids. There's a reason why you can't just eat a few potato chips, right? You open that bag up and you know exactly what's going to happen. You're probably going to finish it off, or you know, sometimes you'll leave one or two chips just out of guilt, so somebody else can finish it up. But all that salt, fat, sugar, all that is what makes this addictive. So the most addictive, and I know this is not good news, chocolate and ice cream are the most addictive. And you know, that can be hard to take sometimes, right? So this is just to back this up a little bit. This is the Yale Food Addiction Scale, and I just want to point out a couple things. If you look here on the left-hand side, most addictive foods. Now, you know, and look what's on that list: chocolate and ice cream. I told you those were the top. Fries, pizza, cookies, all the stuff I'm talking about. Those are highly processed foods, and those are the most addictive. Now, look at on the least addictive side is what we're going to talk about, some of the whole foods. So you got different fruits there, right? You have salmon, you have carrots, brown rice, water, broccoli, beans, and a source of fiber. We'll go over these, but these foods are the least addictive and the healthier foods. So why am I going over all this? Well, here's the reason. You know, when you eat the wrong way with these processed foods, what you really see is you get the real danger is what we call visceral fat. Now, visceral fat actually is internal. It's bathing your organs. It's surrounding your organs in this visceral fat. That is very dangerous fat. It's an active substance, an active metabolic substance that puts out all these bad things for you. Now, what you notice is the belly fat, right? So that subcutaneous fat, you notice the belly fat. That's what you're actually measuring with that when I asked you to get that tape measure out and measure that. But that belly fat, that belly fat is a surrogate for the visceral fat. So which is really what causes a lot of the problems. That visceral fat leads to what we call inflammation. So let me send it, because this is a major thing that we see in men's health, all health, but we're talking about men's health today. So what is inflammation? So there are a couple types of inflammation. There's acute inflammation. You cut yourself, you scrape yourself, you get some redness, some swelling. That's a good response from your body. That's your body trying to protect you from infection. Now, the bad inflammation is called chronic inflammation. So just think about it, that this was a prolonged, low-grade, smoldering inflammatory response. It just was turned on and didn't get turned off. That, you can call it chronic inflammation. Some people call it metabolic inflammation. The bottom line is that is at the root cause for many of the conditions that I just talked about: diabetes, cancer. It can be, you know, with depression, stress, the metabolic disorders, high blood pressure, cholesterol issues, all the cardiovascular diseases, all of these things, autoimmune disease, low-grade inflammation. And that inflammation goes back a lot to what we eat. That's one of the main things. And so that's why I talk about that. Now, I will eventually get to some good news here, but a few more slides on what else can happen. So this inflammation can cross the blood-brain barrier. And I don't want you to know all the things on this slide, but the bottom line is fat cells put out a hormone called leptin, and leptin is really designed to help to help you to stop overeating as you gain weight. If you have an inflammatory state, that low-grade inflammation, what happens is that the area of the body that controls that leptin release, that hormone called the hypothalamus, it becomes desensitized. So you don't get the right feedback, and then you actually keep gaining weight. Same thing with this inflammation as it crosses the blood-brain barrier. It can affect other parts of the brain that actually are more in tune with memory, brain fog, cognitive decline, all of these different things. And it all goes back to this inflammatory state. So the good news is that these changes appear to be reversible with nutrition. That's really the positive news. So here's where I think we are in this country today. And I'm talking about men, but honestly, this applies to men and women. I call it the medical treadmill, right? You get a symptom. You're going to go into your provider. And when you go in, what do we usually do? We listen to you, we talk to you, and we end up putting you on a medication, on a prescription. The prescription targets the symptom. It can provide some short-term relief, but it doesn't get to the underlying cause of what's going on. So what can happen over time, a lot of times, is that the symptoms get worse, or you get another symptom. So then we put you on another medicine, and then you're on this treadmill, more and more medicines. And that's one of the main things when men come in to see me. They're like, Dr. Billups, I don't want to go on any more medicines for my diabetes or for my hypertension, my high blood pressure, or my cholesterol. What can I do to not do this? And that's what we're going to talk about next. And I tell them you can make these lifestyle changes. So there is a better way. There is a better way, and that better way involves getting healthier. It's not a quick fix, but it's an effective fix. So when the men come in, I tell them, you're at a point, you got two pathways you can go down. You can keep going down the easy pathway. A lot of us have gone down the easy pathway. I've gone down the easy pathway thinking I could fix everything. Or you can take a more effective pathway and really invest in yourself. So why is it the food is linked to all those symptoms, that visceral fat, the inflammation, all those major health issues linked to food. The good news is these symptoms improve within a few weeks. And what's interesting is people are really concerned about weight and the weight changes, but a lot of what I call non-scale victories happen before you actually lose weight. So I've had men come into me and say, Dr. Billups, I've been on this for several weeks, and I don't think anything's working. I haven't dropped that much weight. I haven't dropped weight. And so I point two things out. First of all, I say, well, how many years did you take to get to where you are? So you expect this to clear up in 2 to 4 weeks. But then I asked them, have you noticed, how do you feel when you get out of the bed in the morning now? How do you feel when you're walking around and moving? And then when they start thinking about that, they're like, you know what? Some of those aches and pains, they're gone. And I do feel better. So these changes can happen fast, quickly, and then they progress on. The whole trick is you have to prioritize this. So here's what I tell my medical students is in my opinion, we've kind of reached a point in medicine where most of the patients we see, it's about, as I mentioned, it's about restoration. We have to get them restored back into good health, and then we can talk about prevention. So let me talk to you about a program that we use at Meharry. It's a lifestyle-based program. And I'm going to start out by just kind of showing you somebody who actually went through this, and I'm going to give you a little history of the program, and that'll get us into the lifestyle part of this as we go through and finish up. So this is one of my participants. Ken knows I'm telling his story. Ken actually insists that I tell his story because he's so proud of what he's done. So Ken came in. Ken is diabetic, and he was having trouble controlling his blood sugar. And he told me, he said, Dr. Billups, the reason that I'm here is because I can't control my blood sugar and I want to do something about it. I'm going on all these different medicines. I want to do something about it before you all start hacking stuff off. Those were his exact words to me when he came in. So he was overweight, he had high blood pressure, he had diabetes, wasn't sleeping well, low energy. He just didn't feel good at all. So we put him on this program. And the before and after there is before and after 90 days. So a picture's worth 1,000 words, right? You can look at him before, look at his face and look at the belly area. And I'll show you some of those numbers in a second, but you can see he's made some changes. He and his wife, they jumped right in. They went in, they cleaned out their pantry. You know, he said mindset is everything. And then if you look after 90 days, he said, you know what, I think completely differently about food. He was able to get off of his high blood pressure medicine. His diabetes medicine was cut in half. He had more energy, better sleep. And he just said, you know, I just feel like a new person. So here's some of his numbers, his biometrics. If you look pre and post challenge was a 90-day program that I'm gonna go over in a second. You see, he went from 250 pounds down to 218. His blood pressure was never really a problem. It was a problem, but what I want you to notice is his numbers stayed the same, but he's off his high blood pressure medicine now. So, you know, that did help. He's a pretty tall guy, you can see, but you see his body mass index was 30, so he was in the obese range to start. But look at that waist circumference. He dropped 5 inches off of the waist. And Ken has actually been on this for a couple of years now. These are his other numbers. You see his cholesterol numbers improved. Bad cholesterol, the LDL improved. The HDL didn't improve much, but he wasn't exercising either. He said he was really focusing on the diet. You see the triglycerides, all these things improved. Blood sugar improved. His hemoglobin A1C, that's the long-term marker. So he's doing great. He's been on this for over 2 years now, going on 3 years, and still doing really well. So the program, it's called Heal 90, and this is a program that actually I started with a patient of mine who had a really interesting history and he had managed to kind of lose a lot of weight on his own, you know, saw these effects and was actually quite interested in spreading this around to other people. So Heal 90, it's Heal 90 because it was initially a 90-day program. Now it's more of a continuous program, but it really is it's a virtual education program. So it's a virtual lifestyle education program where we look at how to integrate food and lifestyle changes to help reverse these chronic conditions. It is based on the 6 pillars of lifestyle medicine. So you know, as I got into this, I went ahead and got board certified in lifestyle medicine because I was like, if I'm going to do this, I'm going to do it the right way. So these are the 6 things that the program works on. We'll talk about a whole food, plant-rich, plant-predominant eating pattern, activity, physical activity. Sleep is really important and underestimated. Stress management, another important one. Certainly avoiding risky substances. You know, you probably heard a lot about alcohol and the implications of alcohol now for cancer and all sorts of things. And then positive social connections. Loneliness is a huge risk factor for men. It's a risk factor for everybody, but you know, especially for men. So I want to tell you a little bit about this is how this program got going. So it's just it just kind of it's a good story and it kind of makes sense. So this started in 2018, and it started when my friend, his name is Tony, who's my patient, and now he's a close friend, and he's actually the CEO for Heal 90. He came to me and he said, Dr. Billups, why don't we do a book club as a way to help engage men into your men's health practice? And I honestly said, Tony, you're crazy. Men are not going to come to a Saturday book club, virtual or not. I was like, this is a waste of time, but I'm going to humor you and go ahead and do this. And we did this, and I'm going to tell you, it worked. We had a year-long book club, and we read about 4 or 5 books, and we had it on a Saturday morning, And men, showed up, read the book and everything. So that was a lesson for me. So then we went from, the book club to kind of a weekly virtual educational seminar. Then we packaged it into a 90-day program. And that's what Ken went through. It started out just in Tennessee, but now we're in close to 25 states now. We have kind of people all over, and really just kind of spreading word of mouth from people who went through it. We've now extended this into. We always knew 90 days was not enough, so now this has extended to a continual program. And most recently at Meharry, through Meharry Health Network, we've actually integrated the Heal 90 program into a primary care medically based program that we call a restorative health program. And I'll go over a little bit of that. So really exciting for me to watch how this evolved and to watch how it's impacted people's lives. So if you look at what we really focus on in this Heal 90, in this virtual education, 4 basic things. I call them the 4 E's: educate, engage, equip, and empower. Because what I know is, if I can educate, if I do those first 3, educate, engage, and equip you, if I empower you, empowered people act. And remember I said, how do you get people to act around behavioral changes? And you have to empower them. And education is one of the most important things. So what we have is there's a comprehensive medical education part where we talk about nutrition. We focus on nutrition first and initially and strongly on that, because that gets the biggest results. We end up getting to all the lifestyle pillars, but the nutrition and the exercise, but especially nutrition. This is all done virtually, which is part of the reason why I think that this works. We do it in cohorts. So you may go through with a group of anywhere from 25 to 50 men. The program is for men and women, so we have men and women's groups, but we're talking about men's health here. That's how it started, because I'm a men's health physician, and those cohorts, I think, really were important because it really provided accountability and as well as support. So some of the conversations we have are quite interesting, because when anybody starts this, you're going to have your ups and downs, and you may fall off the wagon, do things like that. It's really interesting in the cohorts, when somebody stumbles, the rest of the group really picks them up, and they're like, "Hey, we've been there before," And so what we tell the men in the cohorts now is don't fear failing, but if you fail 1 meal at a time. If you're going to, you got to get back up and get going. So it's been very effective. Now, the thing that we've done differently at Meharry that we've started over the past 6 months or so is we've really integrated this into the Meharry Health Network, which is a primary care network that Meharry has, covering 8 clinics in Nashville and in Memphis. And so we now have what we call a restorative health solution program that really integrates the lifestyle education component with primary care physicians who really are focused on restorative health. So we talk about the whole food, plant predominant nutrition, the education. I talked about that, but then that's integrated into shared medical appointments and clinical visits, using platforms, and it's really been quite powerful. We're just getting this up and going full steam, but it's been interesting to watch the cultural change among the providers in the practice, the excitement among people in the community when they learn about this program. So as I mentioned, it really is right now we're focusing more on just using it as part of the chronic disease management portion of the primary care practice, with these different group appointments and then the individual appointments. It's seamless for the patient. So the patients don't know about Heal 90 versus anything else. The patient going through just knows that they're going through the restorative health program, and that's how we kind of take them through. So it's been great. Now, why is this important? It's important because if you look at why this matters, well, one, lifestyle gets at the root cause. Remember I mentioned the medicines address the symptoms. They do not hit the root cause of the problem. So lifestyle gets at the root cause. We're seeing cost reductions with getting people off of medications, decreased emergency room visits, decreased hospitalizations, quality of life improves, life expectancy improves. It's helped to address the whole health equity issue. I mean, lifestyle works in all communities, but I mentioned that African Americans have the worst statistics, and African American men have the absolute worst health statistics of anybody. So that's been something for me that's been a source of pride and a way of giving back personally, for me to giving back to my community, as I've seen many of my family, friends, and relatives, fall unnecessarily from preventable diseases. And of course, we're gathering all the traditional medical data as well as lifestyle data. So really exciting about that. So let me just finish up with a few things that we, what do we focus on with the men? Some of the things that I think are really important. One is, what you eat changes everything. It can, your energy. The biggest thing that I talk to the men about is I have them go through their numbers when they come in. Cholesterol, blood sugar, all those numbers I talked about. And then first I ask them, do you know what this means? I let them know what it means. And I say, okay, here's what I'm going to tell you. If you change your lifestyle and what you eat, you can change every single one of those numbers. You can take control of what's going on with you again. And when that light bulb goes off, and the men that it goes off on, I almost can't hold them back. So I tell them food supports healing. We talk about vegetables and micronutrients, how we can fight inflammation, and what nutrition does. And that is where the education is an important part of engaging and empowering people. So we really focus on that whole food, plant-based program. We have different recipes. We do food demos because I think where we were in medicine before, and I was part of this, was my lifestyle, my approach to lifestyle before I really got into this was, you know what? You need to eat better and you need to exercise more and come back and see me in 3 months. And that doesn't work. You really have to walk people through it. And when you do, the results have really been amazing. So we talk about that inflammatory process, the anti-inflammatory reset. This is something that we really drill home. The whole food plant-based approach is a nutrient dense approach. It's not a calorie dense, it's nutrient dense. We don't count calories, because this is about nutrition, green leafy vegetables, antioxidant rich berries. I love blueberries. I could eat blueberries all day long. And then if you look at things like flaxseed, would they give you omega-3s? It decreases estrogen. All these different things, you're really changing that inflammation in the body. And a lot of this is just making the men aware of this. So we talk about how you can eat fresh and nutritious snacks that give you vitamins. That middle piece in there, that's what you want to avoid, right? Convenience. And that's what we tell the guys. Hey, it's convenient to walk into that store and just grab that snacks, and when you're trapped. But with a little bit of planning, you can make swap outs and eat much more, wholesome things that are much easier to make. I use carrots quite a bit because one of my big weaknesses was potato chips. And what I realized was I needed to eat something crunchy, but I can satisfy that with with carrots. And so we spend a lot of time on that. We talk a lot about fiber. Fiber is really important. This country is about 97% fiber deficient. And so fiber really, a lot of men come in, they want, how do I lose this belly fat, right? Because that impacts your everything, your health, your testosterone, your sexual function. And a lot of that fiber in the green leafy vegetables, that really attacks that area. So that's one of the secrets to weight loss, lowering your cholesterol, better blood sugar control. So a lot of things there. And then water is another really important one that we talk on. So adequate hydration. And I used to be daunted by the fact when they said, oh, you should drink 60 ounces of water. And I wasn't initially a big water drinker, but then one of the points that we bring out to people is if you eat the right foods, if you're eating fruits and vegetables, they're water rich. So you're actually getting a lot of your water intake in, with what you eat, if you're eating the right way. And then you still need to obviously drink and support that with water. So we've had great success with this program. This is just from the 90-day program. Everyone feels empowered that goes through this. Almost everybody loses weight. You can lose weight at different weights. But what I'm most proud about is the number of people that were actually able to either reduce their medications or get them off of medications. And these are people that actually go through at least the 90-day challenge and take it seriously. So I'll end up with this. This is what I ask every patient that I see going through the clinic, or when I see you. You come in and I listen, and then at the end, this is the way I approach trying to really get you to think about lifestyle changes and doing that. The first question I ask them is, are you curious about your health, or are you serious about your health? And as men, we don't back down. So everybody says, "Oh no, doc, I'm serious." So I know the answer to that already. Then the next question is a little bit tougher. Are you willing to give up things that are making you sick? And that takes a little bit more for them to, excuse me, to actually think about that. And then the last question is, are you considering making a change? And if so, when are you going to make that change, and how confident are you? That gives me an idea of how ready are you? Are you, and the people who are either within a month of making a change, or they're already trying to make a change, but they don't know what to do, those are the ones that are most effective. I think that might be the last one. Yep. I'll stop there, and let me get a glass of water too.
Excellent. Thank you, Dr. Billups. Really appreciate that. Great presentation. I have a handful of takeaways that really caught my attention. If you don't mind,
go ahead. I'm good.
One thing that struck me was some similarities between your experience with lifestyle medicine in your personal life and then in practice with your patients. So something that very annoying happened to you. You tried eating healthier and it worked great. And so you were kind of obliged to stick with it. And after you got healthy, this was my experience too. I was taking care of a lot of people with diabetes at the time when I was restoring my health. And it's after it happens to you, how can you not bring it to your patients, right?
Exactly. Exactly. And I think that's you're absolutely right. How can you not bring it to your patients? You can also look your patient dead in the eye, and every excuse they have, you're like, okay, I've been there. So I'm gonna listen to all of this, and I've crossed it. And the other big thing is, when I talk to my medical students, I was like, you really need to experience this for yourself. And one of the big things we did with this new program we're starting is the restorative health. We had all the providers go through the Heal 90 program, the first 90 days.
All the providers in your health system?
Well, these are the clinics I have. Okay. So it's like 20 providers that's my little cocoon that I have. So I knew the whole goal there was to change the culture of how they think about restoration. So we had them go through the program, and for two reasons. One is, I said, I want you to experience what I'm going to ask you to put your patients through. But then I also want you to experience it for your own health challenges. And what was really interesting, what really made the light bulb go off when I talked to them later after that, they were like, man, I had no idea. This impacted me. And then all of a sudden, it's just like you said, how can you not do this to your patients when you've experienced it? And that, so yeah. There wasn't a whole hell. I was fortunate. I had a smaller group that I could do this with, but it worked. It worked beautifully, and that was the beginning of changing the whole culture of our primary care clinics.
it's it seems to be the case that um, when you're trying to help someone else, doing it yourself is just so helpful. I mean, you can't replace that. And then the other thing is when you love someone, but whether it's your patients or your family members that you're trying to help, you you want to bring something like this to them when you have your own experience that just transforms the way that you look at health and food.
Yes.
So I see that in a lot of my patients too, where they feel better and they want it so badly for their spouse, for their kids, and there's just a beautiful synergy too with it's almost like a motivation for them.
Mm-hmm. Yeah. It spreads when we hadn't extended the program to pediatrics yet. Now the program is men and women, and it's interesting when we got the primary care practices, the pediatricians were like, "Hey, we want to do this. We want to extend it." So now we're developing a whole pediatric arm, and they said the pediatric part starts with the parents, right? So it's almost like if you get the parents on board, and then you move into the children. So we're expanding it into that. But that really was interesting. They were like, well, why haven't you done this? And I said, well, one, I'm not a pediatrician, and I just, but I said, but I welcome the input. So they're all into that now. So it's been great. It's been just great kind of watching.
That's awesome.
Yeah,
I'm excited for your program. And I was interested to hear about your program too, the Heal 90, because you probably saw this in your reading that basically the doing is the hard part when it comes to healthy living. And so research subjects and patients that have the most success are generally the ones that go through a structured program, right?
Yeah. Yeah.
And but where do you get that? It's only a handful of clinics like yours and mine that are even offering this.
That's right. That's exactly right. And so just like I do, that makes all the difference in the world, because you can hand people all the pamphlets and tell them to do all you want, but if you don't get them involved and kind of walk them through some of those difficult first steps when they're starting, you and I both know. I knew before when I would say go eat better and exercise more and come and see me in 3 months. I knew exactly what was going to happen, right? I was just busy and I had to get on to the the next thing, but I knew exactly what was going to happen.
Yeah. Well, it's like you said in one of your earlier slides, the food is pretty much addictive, the normal American food that we grew up with. And so when you have an addictive food for decades, it's not easy to get away from that.
Yes. Yes.
I'm curious to ask, by the way, because your Heal 90 started with like a book club. What book did you pick for
the first one? What was I'm trying to think of the very first one we did. One of it was.
It wasn't your last, was it?
No, it was one of them. Man, I'm blanking on a name. I'll have to send it. I'll send it. It was one of them was The One Thing. It was more of a goal setting book because we were trying to get them focused on goals and what and what you do. And I can't remember the first. It's been so long. I can't even remember the first one we did. Yeah, I'll have to go back and look. Tony would know.
Oh, well, because that's probably where you get insights such as like one failure at a time. That was one thing you said I really want to take away and remember.
Yeah,
just avoiding that despairing, giving up, kind of the relapse into the addictive foods versus like staying in the fight.
Yes, fail one at a time. And with the Heal 90 program, the most interesting part, when you get people together in these cohorts and they're talking, the patients, the participants, they almost tell you all the tough points, what you need to take. Just listening to those conversations, you learn so much about what people are thinking. And a lot of people, they would get down on themselves. They're like, you know what, a few things went wrong, I'm just going to give it up. And that's where the other part of the community would come in and say, no, don't do that. We've kind of gone through that before. So we usually have a mix of a few people that are in each cohort that are veterans. They've been doing this for a while, and then you have the newer people. So you get this you get this perspective that the participants are speaking, and then really all I have to do is I'll just come in for and just, put my little 2 cents in, and but usually the other participants actually interact and take care of this. So it's been an interesting dynamic, for me as a provider, because I don't know about you, but I wasn't trained in any of this stuff in medical.
Oh yeah, no way.
So, yeah.
One thing I think that happens there with the group stuff is we kind of start from a place of pride where you mentioned that, like, oh, I'll just flip a switch and decide to be healthy when I'm done with residency, when I'm done with my fellowship, when I've established my practice. But then it turns out it's really hard to do. And one of the things that getting serious about transforming your health means is that I think you're willing to accept some help.
Yes, that's exactly right. Yep. And you're right. That's hard to do. I mean, the easy part is, well, I'm just too busy. I don't have any time for this. But then you're right. Just coming to grips that, you know what, I'm not going to handle this on my own. I've been saying that for years, and everything is just getting worse and worse. And like, and I don't know why I even decided to go, because I said, I am not coming to Chicago. I'm not going to this meeting. I don't have the time. I don't want to learn how to eat like that. And I don't even know what, something just said, you need to go. You need to go. And that was fortunate for me that I went, because then once I went, and the evidence base just, I had all this research training, and the evidence base just smacked me in the face, and it was just like,
Yeah, I know, because I remember how astounded I was when I read that you could control diabetes with food. I didn't learn that even in residency, I thought, and I was just completely blown away.
Yeah.
Well, one final thought I want to ask what you think about this is you open with a theme that with the Thomas Edison quote about the doctor of the future. And I wonder how close we are to that, to being the doctors of the future and then the patients of the future. So, I mean, it looks like we're making progress. Are you optimistic?
Yeah. I am optimistic. I think that we are making progress. I think two things are going on. One, on the patient or consumer front, people are getting more and more educated. I tell my medical students now, I was like, you need to understand the implications of lifestyle medicine, because the public, your future patients, they're getting educated on this. And if you don't know this, because we've had people go through the program and they'll go back to their physicians and they'll be challenging, like why can't I cut this medicine or come off of it? So I think the public is definitely getting more educated. And I'm hopeful, because I see the younger physician generation as being more into, like, when I give a lifestyle medicine and lecture, and I'm giving one to our second years on Thursday, I talk, and it may be a 45-minute talk, and I take like 40 minutes of questions, right? I mean, they are into it. They're like, why are we not learning more about this? I want to know more about this. You can see they carry their water jugs, and they have, it's healthy. And I tell them, I said, you all are the ones that are going to change the cycle. It's not going to be people. I mean, you're younger than I am. I got in, and I'm glad I had my personal experience, and it changed me. But I was like, you all are the ones that could make the impact for not only yourselves, but for the patients. So I am optimistic. I think that there's a lot of work to be done. And the ACLM is doing a lot of that heavy lifting, is just getting people involved. But then I think, people like you and myself, and I feel like it's incumbent to do everything we can to educate not only the public, but like I said, the student. I love talking to my students, because I was like, they're thirsty for knowledge. I like to get them early and I tell them, when you get on the rotations, challenge your attendings. Challenge them about why they aren't doing it. And they get upset, you can tell them, Dr. Billups, you can blame it on me, but and they're doing it. So I am optimistic. So
All right, I'm gonna try that. I'm gonna challenge my students to move the medical culture forward. And man, I'm so pleased that we have uh, some of our allied healthcare workers and our patients. You know, like it's a team, and
Yes.
we're all kind of moving ahead to almost like better health technology somehow. Just getting back to eating like normal healthy food for human beings.
Yeah. Yeah.
So
And it is a
so thanks
team.
for
You're
being a part
absolutely
of the
right.
team.
Yeah. It's a team. It is a team effort. So that is 100% true.
Excellent. Any final thoughts before we close?
No, I think we've covered everything. Yeah, I think that we hit all the key points, that I wanted to bring up. So
Fantastic.
yeah.
Well, let me just give a few quick reminders for our audience here as we all continue our Plant Powered Challenge journey this month. That you can find the links to all our sessions in the weekly emails. That friends and family can still sign up. It's not too late. It's free. It's open for everyone, and they will receive all the content that they've missed so far in the confirmation email. I also hope that everyone enjoys this week's challenge. Don't forget to try the delicious recipes that our chefs come up with and send out. And if you haven't watched the cooking demo yet, speaking of, be sure to check it out. It will help you be inspired to eat this healthy food we're talking about. So, Dr. Kevin Billups, thanks again for being here today. And our beloved audience, thank you too. And we'll see you next time.
All right. Thank you.